Hey everyone, welcome to this week's live and podcast. We are going to be talking about testosterone therapy, what to know. While most people think about testosterone therapy and males, well, it also impacts females. Okay. Females have testosterone and it's important to check it for them as well. But what we are going to do first is we are going to dive through how the body actually produces testosterone. Then we are going to look at things that negatively impact the body's ability to make testosterone, as well as what does testosterone replacement therapy even look like? Because when you do this, you get a better comprehensive picture of what should be done with testosterone replacement therapy, but what are things you can do naturally to try to help your body produce testosterone on its own anyways. So here we go. We are going to dive in head first into the research and go from there. And if you haven't, please give me a like, comment, share, and subscribe to this channel. And who am I? I'm Dr. Spencer Zimmerman. I'm licensed both a doctor of chiropractic with a diploma in chiropractic neurology, as well as a nurse practitioner. And I ultimately blend both areas to provide patients treatments that they wouldn't have got otherwise. All right, so the very first thing we're looking at is this is a diagram of what actually happens when the body is producing. Okay, so it starts with your brain. A part of your brain known as the hypothalamus communicates to a gland. We see this one here in green, known as your pituitary. Your pituitary releases two signaling hormones that goes to your testes. Okay, one is FSH. FSH is super important, as we see with sperm health. And then we see LH. LH goes to and says, hey, let's produce testosterone. Okay. So this is what the body does, right? So the brain sends signals to another part of the brain, which then sends down to say, hey, testes, let's produce testosterone. Now, in females, this is done through partly the ovaries, but also part known as the adrenal glands to produce testosterone. And then with testosterone production, okay, testosterone is ultimately converted into other things, right? So testosterone is used, but it can also be converted into estrogen and then DHT, which is another form of testosterone. All right. So now that we have an understanding of how the body produces testosterone, we then go to the next natural thing, right? Well, if this is how the body produces testosterone, can we check this? And the answer is yes. Now, there are more labs than this, right? But here's an example. When you get your testosterone, please do not get just a total testosterone. You should always be getting a free testosterone. Now, it is preferred to use LC/MS. Okay. This is the type of testing that's done. This is more accurate compared to other forms. Now, total testosterone naturally goes down as we get older. It shouldn't go down a ton, but it does go down. But what matters most is your free testosterone. Free testosterone is what the body actually uses. So if your free testosterone is low, then that is actually what I do treatment based off. It's not based upon, well, your total is off, because your free is what matters a lot more. But as we previously noted, right, your brain has to signal to your testes to produce it. Okay. So getting an LH is really important because you can have brain-based issues that's causing it versus testicular issues. And it does open up some treatment options for those that don't want to do straight testosterone. Now, there are a lot of different things that can impact testosterone production. So some of people, they don't really care. They say, well, you know what? I got my testosterone levels and my testosterone's low. So I just want to go straight to testosterone replacement therapy. And you know what? Okay. But it's really not the best option. The best option is to say, well, is there things happening that's preventing my body from producing testosterone? So we are going to cover a few of those things that impacts the body's ability to produce testosterone. So the very first thing we are going to look at is sleep. So sleep is one of the most important aspects of health, but unfortunately it is routinely ignored. So this is from a research article called Obstructive Sleep Apnea and Testosterone Deficiency. Now, what they found was both the quantity and quality of sleep affect testosterone levels. So it's not only important that you get enough sleep, right? 7 to 8 hours, but that you're going into the proper stages of sleep. So they noted patients with obstructive sleep apnea have less REM sleep, reduced deep sleep time, increased nighttime awakenings, sleep fragmentation, so it's kind of broken up more than it should be, reduced sleep efficiency. Ultimately, this can lead to low testosterone levels. Now, there are other things that can occur as well. But if you've got sleep issues, if it's taking you a while to fall asleep, if you're struggling to stay asleep, you're tossing and turning, you've got lots of snoring, make sure you're getting sleep checked, because having issues with sleep can absolutely tank your testosterone levels. This is true not only for males, but this is also true for females. Because once again, right, we think about testosterone with males, but females have steady levels of testosterone throughout most of their life. And low testosterone in females can create many symptoms that overlap with the same thing guys get: fatigue, brain fog, motivation, right? Can all be impacted with that. Next, diabetes, right? So if you have type 2 diabetes, you are twice as likely to suffer from testosterone as a man without diabetes. So please make sure you do not have diabetes, okay? Know what your blood sugar is, know what your insulin is, know what your A1C is. And even flirting with diabetes can still impact your testosterone levels. But on the other side, we look at this research article published February 2024, effects of testosterone on progression from diabetes to diabetes. Now, ultimately, what did they find? Okay. In men with hypogonadism and prediabetes, the incidence of progression from prediabetes to diabetes did not significantly differ between testosterone and placebo men. So ultimately, right, testosterone, using it as treatment isn't necessarily going to fix your prediabetes. Just know that, okay? But what else do we know? Low testosterone levels are related to oxidative stress, mitochondrial dysfunction, and even cardiovascular markers in type 2 diabetics. So once again, diabetes is going to tank your testosterone levels, but getting your testosterone levels up doesn't necessarily impact your blood sugar markers. Now, I get it. There are some research that says, well, maybe it does, but it's not yet conclusive. So, diabetes, blood sugar, right? Get it under control for your testosterone. Next, obstructive sleep apnea. Please make sure you don't have sleep issues, as this will absolutely impact it. Now, what I want to go into is an area that a lot of people don't think about, and this is looking at environmental chemicals and what this does. So we ultimately have endocrine disrupting chemicals, okay? Endocrine disrupting chemicals that are abundant. These are microplastics, nanoplastics, and other things. These are found in food, they're found in makeup, they're found in clothing, and many other things. Now, this is a big deal because these are used all over the place. We see these microplastics, BPA, right? Which lots of people are drinking out of plastic water bottles. Have you ever thought that plastic water bottles could be the cause of your hormonal issues? And I understand we're talking about testosterone, but this goes true for females. It could impact your estrogen, your progesterone, but it can also, as we see here, impact your thyroid, your adrenals, right? So these can impact it, okay? Now, these ultimately build up, right? So they say bioaccumulation due to their Trojan horse effects, right? So they come in and then ultimately it ends up creating issues. And the problem is, we went to microplastics way before we should. Now, we're going to click here and look at exactly what happens. Reduce sperm quality, decrease testosterone levels, right? Impacts testicular health. Sperm again, sperm motility. And this is a really big issue because if you look at infertility rate in males, it is only going up. And is it any surprise that as obesity rates are all-time high, cardiovascular disease, diabetes, processed foods, chemicals, and everything else, that, hey, fertility rates have taken a hit. Now, what else do we know, right? Here's another one. Okay, there's these PFOAs, right? Basically, we get these forever chemicals. They're in a lot of the non-stick cookware. Once again, these are in clothes and everything else, right? Soil, they get into our water supply and ultimately plays a big role, right? So exposure to these is negatively correlated with changes in testosterone levels. So do not forget about the role of chemicals and its impact on our testosterone. Next, this is a graphic from an article, and they look through here, right? Okay. Environmental pollutants, insecticides, herbicides, and fungicides. These are endocrine disruptors. Once again, it's our endocrine system that is responsible for helping our bodies produce hormones. Yes, once again, I understand we're talking about testosterone, but this also applies to females, right? Big reason with breast cancer, menopause, other things like that. What it does is it reduces testosterone, FSH, LH levels, alters testicular structure, ultimately impacts, right, proper puberty, sperm, all sorts of stuff, right? Does a lot of bad things, can lead to infertility. Next, arsenic. Arsenic is a heavy metal, right? It is a toxin that is widespread in our water supply. And I'm going to show you this in a minute, how you can check your own water supply and say, is arsenic something that's a big contributor there? Well, arsenic impacts males and females. Males, it's going to impact, once again, sperm, testicular function, ultimately impact testosterone levels. Females, it can lead to spontaneous miscarriages, impact estrogen, progesterone, disrupt menstrual cycle. Okay. This is not good. Now, the good thing is about arsenic is simply avoiding sources of it can have a really big impact on how it's going to impact you. So you may be wondering, well, what do I do? How do I do this? One of my favorite resources is going to what's called the Environmental Working Group. And they've got what's called a tap water database. So let's use, right? Let's use this zip code, right? This is going to be in the Nampa, Idaho area. And we're going to type in your own zip code. And we're going to do city of Nampa. And what this tells you is contaminants detected that exceeds the Environmental Working Group's health guidelines. Now, when we look at the FDA's number, and that's meant about like what are things that are going to kill you, right? Things that are going to do it really fast. But what happens when you get routine exposure over 10, 20, 30 years? That's really not talked about, but it should be, because it's long-term exposure to many of these things is what's most detrimental. As we talked about arsenic, their recommendations, right? Guess what? 1,132 times the recommended amount by the Environmental Working Group. Now, some people say like, oh, but it's half of the legal limit. Okay. But half of the legal limit still isn't healthy, especially when we're talking about this level of exposure for years and even decades. So now there's all sorts of detoxes and cleanses that people do to help with heavy metals, environmental toxins. But for me, the very first part you should start off with is reducing exposure, because you can do the best detoxes in the world, but if you're routinely exposed to things, you're not going to get the improvement that you should. Now, testosterone replacement therapy, right? Let's say you've done everything, your levels are still being impacted, or right, because it does take time to remove a lot of these chemicals from the body. It's not a short process. And you're like, but I feel bad, right? I've got brain fog, low libido, motivation, maybe I'm depressed, muscle recovery's off, and I just want to do testosterone replacement therapy. What I do with my patients is we do it based upon symptoms and their free and total testosterone levels. Now, the best way to really do this is through injectable testosterone, and we do it in a way that kind of mimics how the body's producing it, right? So we're not doing massive injections every couple of weeks. I'm actually splitting it up at twice a week, but we're doing it at lower amounts compared to what would be done if you're doing it every 1 to 2 weeks. And what you do is you trial it, because people need different levels of testosterone, right? Even though there's a lab range, some people feel fantastic at the 25th percentile. Some people have to be the 75th percentile, because the problem when we look at the labs, even though the labs tells us what an estimated free value is of what the body can use, we don't truly know what's happening at the receptor site. Receptor site is what really matters the most. So it is okay to kind of fluctuate within the range and see how you do. Because guess what? The benefits of testosterone, there's plenty, which we didn't go into, right? But cardiovascular health, brain health, immune system health, bone health, mental health, and so much more. So I hope you found this information useful. If you did, please make sure to follow me and subscribe on the YouTube channel, as well as comment. Let me know what questions you have. And as I keep doing future videos, a lot of those questions and input from you will help decide what I produce in the future. Until next time, this is Dr. Z.